Good morning and welcome to Behavioral Sciences of Alabama. This video is the first video about our intensive outpatient treatment program for those with obsessive compulsive disorder. So if you have obsessive compulsive disorder or you know someone who does or know someone who might benefit from treatment, this video series is for you. Today I'm going to give a brief overview of treatment, what it looks like, and how we do it here at Behavioral Sciences. When you first come to treatment here at Behavioral Sciences for an initial interview, we'll sit down with you and get a list of common obsessions and compulsions that you have. Once we've accurately identified those obsessions, compulsions, and things that trigger those obsessions and compulsions, we will then have you do what we call a subjective units of distress scale and rank those triggers or items on a scale from 1 to 10. 10 being this is very discomforting and 1 being there's very little discomfort. So once we've developed the list, the treatment begins. So there's two aspects of treatment that I want to talk about with you today. One of those aspects of treatment is exposure. The other half of that is response prevention. So let's say we have a list of your common triggers, obsessions, and compulsions. So once again, I've already talked about ranking them. So we take that list and we'll start with some of the items on that list that are at the moderate level. We'll pick one and we'll do exposure. Well, exposure is the act of staying in a fearful or fearfully perceived situation, right, that is uncomfortable until anxiety decreases. For example, if you had a contamination fear, I might have you touch the bottom of your shoe and then sit with the discomfort of having the dirt on your hand, or maybe even have you touch your face with that hand if you were able to do so. That is an example of exposure. Response prevention is the act of resisting a compulsion or ritual that usually stems from an obsession. So let's take that shoe example again. Say you're sitting now and you feel contaminated because you touched the dirty hand right to your face. Well, a natural compulsion might be to need to immediately wash your hand. In this type of treatment, we would ask you to resist washing for as long as possible. And that is the response prevention part of treatment. So as a client, you will be asked to engage in exposure exercises and resist compulsions. But you will always be prepared and know what's coming the next day in the treatment plan. So you can prepare yourself for that. And of course, we always go at the client's pace. So we're not going to throw you into things that are extremely uncomfortable. The reason that this works, and we know this through research, is because extinction occurs via habituation. So let's say, for example, this is my turtle, right? If a turtle sticks his head out and I tap it, he tucks his head back in because he's fearful of the stimulus, which is my finger, right? Well, over time, if the turtle keeps sticking his head out and I keep tapping it, right, then eventually he is no longer afraid. Habituation occurs when sensory neurons in someone's brain get fatigued. That's essentially what's happened here to our turtle. His sensory neurons, right, have become fatigued. And extinction causes that fatigue, and thus the fear is extinguished. So that is the reason that we do this type of exposure. That's a basic intro to treatment and the two main parts of treatment. If you have further questions, please feel free to contact us through our website. And thank you for your time. We look forward to seeing you soon.